Good afternoon. I'm Laurel Powers-Freeling, Chair of the National Joint Registry. In the nearly 9 years I've had the privilege of being part of the NJR, the scale, reach, and impact of our work has developed beyond what anyone could have imagined when we first started collecting data in 2003. Now, over 3 million records later, we are not only the largest orthopedic implant registry in the world, but arguably, and we know that there will be some people who will argue, we are also the most advanced and outcome-driven. We make a real difference in what happens. Now, anytime people come together for a speech, presentation, or discussion these days, usually on Zoom or something like that, it's now customary to note that 2020 has been a year like no other, and that we are all striving to find a way forward from the dark cloud of COVID-19 as a shadow over the entire globe. And as practitioners of the coalface, you'll know just how much the pandemic has changed how you do what you do in every way. Much of what has happened has been made up on the hoof, some of it heroically and with singularity of purpose, some of it less so, and leading to a good deal of confusion. But for the work of the people at this conference, and consequently for the NJR, COVID-19 could potentially undermine years of progress in giving patients perhaps the most successful and life-enhancing surgeries available, arthroplasty. At present, we know that there are nearly 300,000 patients who have waited over 18 months for hip and knee replacements, an increase of nearly 200,000 since the beginning of the pandemic. Compared to the usual thousands of joint replacement procedures being carried out per month, we are still in the low hundreds, and these are largely trauma cases. And as these patients wait, their health deteriorates and potentially costs the NHS far more than the cost of a hip or a knee replacement. Many can no longer contribute positively to the UK economy as they might have with restored mobility. They may be more inclined to depression. And frankly, they may simply die sooner than they need to. While, of course, the NHS must prioritize urgent procedures for cancer and other diseases, we're storing up a whole new set of problems by deferring much-needed arthroplasty for what will be literally hundreds of thousands of people this year and probably next. And, disappointingly, we are well behind other countries in re-engaging in these important procedures. In some European countries, caseloads are heading back to normal levels. Germany, for instance, particularly stands out, with levels in June now back to or even above their volumes of hips and knees in the previous year. There are, of course, many reasons for these differences, and it would be unfair to put it all down to an underfunded NHS, but we do need our health ministers to understand the implications and effects that this situation will cause. The effect on the UK of buying independent sector capacity for the NHS urgent surgery that must be done has reduced its capacity for elective surgery of all types, with the impact that will be very substantial. And this will also have impact on us at the NJR as well. Especially the NJR budget in the coming years. The NJR is funded largely from NHS trust and independent sector hospital subscriptions. NJR subscriptions are calculated on a per-procedure basis, as I'm sure you know, such that the amount paid by each provider is determined by their volume of joint replacement activity and is charged on an annual subscription basis. The timing of the subscription calculation is such that there's a 1-year lag between the volume of activity and the amount that's charged. So, given that COVID-19 will have a significant impact on elective procedures through the period of 2020 and possibly 2021, most likely 2021, it's actually NJR's 2022 and 2023 funding that will be perhaps less than a quarter of what we actually require to operate. Now, given that, as you would imagine, we have taken some very, very tough decisions this year as to what we can afford to do in order to retain some kind of cushion for the trouble to come. But it does mean that over the next 2 and possibly 3 years, we'll be under real pressure. And what and how we deliver may have to change. But that's all focusing on the negative. Over the next hour or so, we want to share some more positive and useful insights. At NJR, we are proud to work with the British Orthopaedic Association, and you'll hear more about that from Tim Wilton. We'll share some key insights from our work utilizing our data in relation to infection improvements, improvements in practice, and surgical approaches. We'll talk about the impact of obesity, and we'll get some new views on knee surgery, upper limbs, and a report on dual mobility hip replacement. So, without further ado, let me hand over to Mike Reed, chair of the NJR's editorial board, to get on with the show. Thank you very much.
Laurel, thanks so much for that introduction. What I'd like to do now is to introduce the audience to the 17th annual report for the National Joint Registry. So this is the 17th annual report, and it includes surgical data right up to the end of December 2019. It therefore excludes the pandemic and is a complete data set. This report this year is online only, so it's available online as a PDF, and we'd be keen to get your feedback on that. So I'm just going to move on now and talk about what we have in store for you today. First up, we'll have Tim Wilton talking about really the theme of the BOA Congress, which is working together, and we'll be talking about the agencies that we work with in terms of the NJR, and I'm sure Tim will be touching on the Cumberledge report. We're then going to have a section on key learning from the registry, and we've chosen several topics which have been really focused on this year or the last couple of years, and we think there's some key learning that many people may wish to see. And then finally, we'll have a section on what's new going forward. And this is more about the future of the NJR and emerging themes, really. So I hope you enjoyed the virtual congress, and I'm going to hand you over to Tim Wilton now, who's our medical director.